Hi, I'm Laura. I'm 33. I'm a doctor. I've come from the UK. I'm from London, but spent my working career working in Wales. I'm currently working in Sunshine Emergency Department in the Western Health. I've been working for 3 weeks. Came over to Melbourne and quarantined the end of August. So before moving over here, I was working in emergency medicine back in the UK. Throughout the pandemic in the UK, I've worked in multiple different roles. The start of the wave back in March, I was working in the acute medical teams, so dealing with the sick patients coming in with COVID, managing the COVID wards. I then got re-recruited back to intensive care, where I've had previous experience working because they were very short-staffed. And then spent the next couple of months working in the COVID intensive care back in the UK. And then the third wave, I rode out in the emergency department in a different hospital. That's really my experience. I decided to come to Melbourne because emergency medicine in Melbourne has a very high global reputation. I've come to develop my own skill set. And I've been here now for 3 weeks. Back in the UK during the waves, it's quite tough. My colleagues have already discussed about how you've had to treat colleagues, you've had to treat their family members, you've had to deal with colleague deaths, and we weren't immune from that in the UK. There were lots of resource issues in the UK in terms of when the waves were very big. Decisions had to be made about how to rationalise oxygen. Lots of fears about hospitals running out of oxygen, not having enough intensive care beds, not having enough non-invasive ventilation. All real issues that faced us back in the UK during the waves, and it's quite difficult to get that across to people who haven't experienced it. And I understand that the numbers in Victoria are rising, are increasing. I really hope that the way that Australia have handled the pandemic, the buffer they've given, the experience they can learn from the rest of the world, the vaccine is really going to help manage that to the point where we're not going to get to where we've experienced globally.
Thank you for coming. To go through what you have just been through in the UK and now what you know is coming, I don't expect you to comment on the politics at all about whether we should be opening up at 80 or 90%, but because you have experienced things opening up, a population being largely vaccinated, are you concerned that numbers are going to rise, or how safe it is that we are going to open up, or you think that that's a feasible option, just in terms of what it would mean for a hospital and the numbers?
I can comment on my experience. So I've worked in Sunshine ED now for 3 weeks. When I started, we had no COVID cases. We're now seeing daily COVID cases and sick COVID cases, mostly in the unvaccinated. But it's definitely a throwback to the beginning of the wave the first time. I can't comment. All I can comment is that when people get together, the virus spreads more. When to open up and amount of population vaccinated, I'm not an expert. Can't really comment. It's a global problem, balancing human life and economics. But currently, all I can say is at the moment, in even just the 3 weeks that I've been working, I've seen the numbers increase quite rapidly.